This recording will go over safe medication administration and error reduction, as well as IV therapy. So the knowledge required prior to med administration is listed here. And if you look at all these different categories, medication category or class, mechanism of action, therapeutic effect, side effects, adverse effects, toxic effects, medication interactions, precautions, contraindications, preparation, dosage, administration, nursing implications. These are the categories that are usually found within your drug guidebooks, and also if you create your med cards, those are the categories that you would list on a medication card. So when we're learning about these different types of medications, this is the information you need to be familiar with. So it can be overwhelming and it can seem like a lot, but these are the things that you do have to know about those different medications. So if you're in the clinical setting now as a nursing student or in the future as a licensed RN, and you get an order for a medication you're not familiar with, it is your responsibility to look up the medication and understand all of these things prior to giving the medication to your patient. Nomenclature refers to the name of a medication. We're not going to worry about chemical names. You do need to know the difference between a generic name or a trade or brand name. Generic name would be like acetaminophen, where the trade or brand name would be Tylenol, right? Generic name ibuprofen, trade name Motrin. For our purposes in nursing pharmacology and while in nursing school, we learn generic names. Sometimes in lecture I'll talk about trade or brand names because it can make things click for you, like, oh yeah, I'm familiar with that trade name, but not so much the generic name. So sometimes I'll mention them so you can associate the two, but for our purposes, you need to memorize generic names. Nurses administer prescription medications under the supervision of providers. Some medications can be habit-forming or have potential harmful effects and require more stringent supervision. Uncontrolled substances require monitoring by a provider, but do not generally pose risks for misuse and addiction. Antibiotics are an example of an uncontrolled prescription medication. Controlled substances have a potential for misuse and dependence and have a scheduled classification. Controlled substances are regulated by the Federal Controlled Substance Act, which divides controlled substances into 5 categories called schedules. Heroin is in Schedule 1 and has no medical use in the U.S. Medications in Schedules 2 through 5 have legitimate applications. Each subsequent level has a decreasing risk of misuse and dependence. For example, morphine is a Schedule 2 medication that has a greater risk for misuse and dependence than phenobarbital, which is a Schedule 4 medication. The pregnancy risk categories listed here are obsolete and should no longer be used, but we do still sometimes see them, so I just want to mention them so that you're familiar with them. With the pregnancy risk categories, the letters assigned to the medications are A, B, C, D, or X. And with A, I think of that medication as being A-OK. So that one is a safe medication, safe for mom, safe for fetus. For category X, I think of the skull and the crossbones, right? The crossbones here making the X, meaning that it's not okay, dangerous, deadly, not going to give it. There's no reason to give a category X medication because it's too dangerous for the patient and the fetus. So again, risk category A is A-OK, and then the categories progress and there's more and more increased risk to the fetus, or there's less known about the safety of the medication until we get to risk category X, which would be not safe. Instead of the A, B, C, D, X pregnancy categories, the FDA instituted the Pregnancy and Lactation Labeling Rule. So what was determined was that the ABCDX categories were a little too vague. This 3 detailed subsections of this new labeling system provides a narrative summary of maternal and fetal risks and supporting clinical data. So it gives providers and patients and nurses and everybody more information about the safety of the drugs. And you'll talk more about medications and pregnancy when you get to OB. For our sake right now, I just want you to know that before administering any medication to a client who is pregnant or could be pregnant, we need to determine whether it is safe for use during pregnancy. So there are times even on a med-surg floor where you'll get a pregnant patient and you need to make sure the medications you are administering are safe for that patient. This slide goes over different types of medication prescriptions. So a routine or standard prescription is what we think about when the doctor orders something that's going to be taken at the same time every day. So I get a medication for my acid reflux, right? I get a prescription medication. It has a specific dose. I'm given specific instructions about when to take it, and it's routine or standard in that I'm taking it every day at the same time. There's no changes. It just continues on and on until if at some point it gets changed. A single or one-time prescription is just that, just a one-time dose. Maybe your patient has some sort of an issue with pain, like a flare-up that we need to address, and the doctor doesn't want to give continuous narcotics or things of that sort, but okays a one-time dose or prescribes a one-time dose of a narcotic to get that pain under control. Stat prescriptions, right? Stat you hear in a lot of those TV shows where they're ordering something stat. That means right now. PRN means as needed. And it's our responsibilities as the nurse to know what's on the PRN MAR, right? So what PRN medications are available to the patient if they need it. And we need to make sure the patient understands that they're there and what they're there for. A lot of times with patients, there'll be a PRN stool softener, right? Maybe they're taking a narcotic that can make them constipated. So there's a PRN stool softener there. Well, the patient may not have any idea that the narcotic is going to make them constipated, and they have this option for a stool softener that they can take. So it's our responsibility as the nurse to understand what's on the PRN MAR, when they may need it, be looking for signs and symptoms that show they need it, and making sure the patient's aware also. Standing prescriptions are prescriptions that are out there. Let's say in the ER, you have a patient that comes in and there's a problem with their oxygenation, right? Immediately you put the oxygen on. You don't wait for the ER doctor to tell you to go ahead and put oxygen on the patient. It's something you just go ahead and put on the patient. There's standing orders for that. Also, let's say you work in the ICU and the patient starts to cold and the blood pressure is going down and all that. There's standing prescriptions that exist to help keep our patients alive when we haven't had time to talk with the doctor. So we're in an emergency situation, we need it right now. Or maybe it's not an emergency situation. Maybe it's a standing order for a laxative if a patient's constipated in a nursing home. So that's an example where my doctor doesn't want to be bothered every time someone in the nursing home becomes constipated, right? So I know I can start giving that laxative if the patient is experiencing constipation. You should be able to recognize if a medication prescription is complete, and if not, you should be able to know what's missing so that you can obtain that from the prescriber. A medication prescription needs the client's full name, date and time of the prescription, name of the med, strength and dose of the med, route of administration, time and frequency of administration, quantity to dispense, and the number of refills, along with the signature of the prescribing provider. When taking a prescription over the phone, right, the doctor is telling you over the phone what they want for the patient, it's important that you read back what you understood to make sure there wasn't any error in you understanding what the provider was saying. The Joint Commission requires policies and procedures for medication reconciliation. Nurses compile a list of each client's current medications, including all medications with their dosages and frequency. They compare the list with new medication prescriptions and reconcile it with the provider to resolve any discrepancies. This process should take place at admission, when transferring clients between units or facilities, and at discharge. This slide provides a list of rights of safe medication administration with the 5 rights of safe medication administration bolded. A lot of times students will say, I thought there's only 5. This textbook has 9. This textbook has 10, right? So there's 5 main rights, and there's additional ones that you can see. So your 5 rights, most of you have learned it as Dr. Tim, right? Dose, route, time, individual, and medication. Then your text goes on, or I'm sure to list additional rights. So right documentation, right client education, Right to refuse is a big one. So your patient has the right to refuse a medication. You as the nurse are required to make sure that the patient's making an informed refusal of the medication, right? So if my patient refuses a med that the doctor has ordered, I need to explain what the med is for, why it has been ordered, the consequences of not taking the medication. I need to document the refusal and notify the provider. Also write assessment. So if I'm giving a blood pressure medication, I better check the blood pressure before giving it, because if my patient has something going on where their blood pressure is low and then I give a medication that makes it even lower, that's going to be a problem. Write evaluation. Same thing. I give a medication that's going to lower blood pressure. I want to come back and check and see that my patient still has a safe blood pressure, right? Was the medication effective and is it safe? I give my patient a pain medication. I'm required to come back and evaluate that the pain medication has alleviated most or some of the pain. This slide provides a list of common medication errors. So we as nurses, we are human, right? And to err is human. So errors will occur. Your facilities will have safeguards in place to help prevent or minimize the amount of errors that are going to occur. But medication errors occur. They occur even with these safeguards in place. This is the reason that when we're teaching you about med administration, we're teaching you to check the 5 rights and to check it 3 times. You know, I've done a checkoff with a student where she was missing something. I can't remember what it was. Maybe the dosage she had off or the medication name itself. She didn't catch it until she was at the patient's bedside doing that 3rd check. So these things that you do and you get into a habit of doing, you should be doing them in every clinical setting, right? Your clinical instructors should be standing there making sure you're doing your 5 rights. Check 1, check 2, check 3, because it's a routine that you need to get into to help promote your patient safety. So some common medication errors: wrong med or IV fluid, incorrect dose or IV rate, wrong client, route, or time, administration of an allergy-inducing medication, omission of a dose or administration of an extra dose, incorrect discontinuation of a med or IV fluid, inaccurate prescribing, or inadvertently giving a medication that has a similar name. So we can use the nursing process to prevent medication errors. So assessment, sort of like we talked about before with the blood pressure medication. I need to know what I need to be looking at prior to giving a med. Maybe I need to be looking at labs to monitor kidney or liver function. Maybe I need to be monitoring blood pressure, things of that sort. I also want to look and make sure that the medication prescription itself is complete. I don't want to guess as to what the provider may have meant for a prescription. I need to make sure that that prescription was indeed complete. In terms of planning, I want to identify client outcomes for medication administration and set priorities. What medication do I need to give first or before specific treatments or procedures? Implementation. To help avoid med errors, avoid distraction during medication preparation. Your phone's going to be ringing. People are going to be trying to talk to you in the med room. Let them know, wait, hold on a second. I got to finish this med pass and then I can talk to you. Prepare meds for one client at a time. Check labels. Double check high alert medications. Have someone else come and make sure you drew up the right amount. If you are at the Pyxis and it gives you 20 pills, that should alert you something might be off here. Don't administer meds that someone else prepared, and don't leave medications on the bedside table. And then evaluation, we want to make sure the medication was effective, and if there was an error, we want to make sure that we document that in an incident report, but not in the patient's chart, and that we also notify the provider.